Welcome back to Life Care for You, where we bring you essential health tips and insights on various medical conditions. In today's video, we'll be discussing HIV/AIDS, a disease that has been the center of global health conversations for decades. What exactly is HIV? How does it progress to AIDS? What are the symptoms, causes, and treatments? Let's break it all down in a simple and engaging way. What is HIV/AIDS? First, let's clarify. HIV, human immunodeficiency virus, is the virus that causes AIDS, acquired immunodeficiency syndrome. HIV attacks the body's immune system, specifically the CD4 cells, T cells, which are responsible for fighting infections. Over time, HIV can destroy so many of these cells that the body becomes vulnerable to infections and certain cancers. When this happens, it progresses to AIDS, which is the final stage of HIV infection. But it's important to note that not everyone with HIV develops AIDS, especially with today's effective treatments. What are the symptoms of HIV/AIDS? Now, let's talk about the symptoms. The tricky part about HIV is that it can go unnoticed for years. Many people don't realize they're infected until the disease has progressed. So, what should you look out for? Early stage HIV. Some people may experience flu-like symptoms within 2 to 4 weeks after exposure. This is called acute HIV infection and can include fever, swollen lymph nodes, sore throat, muscle aches, and rash. These symptoms often go away on their own, which can make the virus easy to miss. Chronic HIV. After the initial phase, the virus can remain in the body for years without causing major symptoms. This stage is called clinical latency. However, the virus is still active and can be transmitted during this time. AIDS. Without treatment, HIV eventually leads to AIDS. Symptoms of AIDS can include rapid weight loss, recurring fever, extreme tiredness, prolonged swelling of the lymph glands, and opportunistic infections like pneumonia or tuberculosis. At this point, the immune system is severely damaged, making the body unable to fight off even minor infections. What causes HIV/AIDS? How does someone get HIV? HIV is primarily spread through the exchange of certain body fluids, such as blood, semen, vaginal fluids, and breast milk. The most common ways HIV is transmitted are unprotected sexual contact. HIV can be passed on during sex with an infected person, especially without the use of condoms. Sharing needles. People who share needles or syringes when using drugs are at a higher risk of contracting HIV. Mother-to-child transmission. HIV can be passed from mother to baby during pregnancy, childbirth, or breastfeeding, though this can often be prevented with proper treatment. Blood transfusions. Although extremely rare nowadays, HIV can be transmitted through blood transfusions if the blood is not properly screened. It's important to know that HIV cannot be spread through casual contact, such as hugging, shaking hands, or sharing food. There is also no risk from kissing unless both partners have open sores or bleeding gums. How is HIV/AIDS treated? Now let's get to the hopeful part. Treatment. HIV may not be curable, but it is treatable, and people living with HIV can live long, healthy lives with proper care. So, what are the treatment options? Antiretroviral therapy, ART. This is the standard treatment for HIV. ART involves taking a combination of medications daily to suppress the virus, keeping it at low levels in the body. The goal is to reduce the viral load to the point where it is undetectable, meaning it can't be transmitted to others through sex, commonly known as undetectable, untransmittable, or UU. ART helps people with HIV maintain a functioning immune system and dramatically reduces the risk of developing AIDS. Prevention. People who are HIV negative but at high risk can take PrEP, pre-exposure prophylaxis, a medication that significantly reduces the chance of contracting HIV. For those who may have been exposed to HIV, PEP, post-exposure prophylaxis, can prevent infection if taken within 72 hours of exposure. Managing opportunistic infections. People with AIDS are more vulnerable to infections like tuberculosis or pneumonia. Doctors may prescribe antibiotics or antivirals to treat these infections as part of the overall care plan. The key takeaway: With proper treatment and early diagnosis, HIV can be managed effectively, and progression to AIDS can be prevented. A final word: HIV/AIDS is a serious condition, but today's treatments allow individuals to live full, healthy lives. This video is for educational purposes only. If you or someone you know is living with HIV or experiencing symptoms, please consult a healthcare professional for proper guidance and treatment. Thank you for watching Life Care for You. Don't forget to like, share, and subscribe for more health-related content. Stay healthy, stay informed.